As a working professional, I was concerned about taking another academic program, particularly at the graduate level, and how much time it would take away from my practice and my home life. However, with this program, I really found that I was able to implement what I was learning into my day-to-day clinical practice as the program went along over the course of 2 years. So that not only enhanced my practice during the course of it, but since graduating, I'm now able to promote that I have this credential, and I'm being recognized and having clients referred to me specifically dealing with chronic pain conditions because I now have these skills and strategies to complement my existing experience. I've been working in the field now for 15 years, and despite that and having graduate professional degrees and so forth, the McGill chronic pain program really provided me with the tools and strategies to most effectively deal with my client population, skills that I did not have before, and really offer strategies through evidence-based practice and from experts in the field of pain as our instructors, which was so valuable. A large part of my practice involves medical legal work, so dealing with the litigation system and personal injury. And what happens in that context is, as I mentioned before, clients often come to me 5, sometimes 7 years post-injury. So they've really learned very well how to become entrenched in disability and how to live with disability, and pain is the barrier to engagement in any form of life activity. Also, with litigation, oftentimes there are external reinforcements of not engaging, whether it be monetary settlement, legal counsel advice, or some kind of tertiary gain. So the program, McGill's program, has helped me to provide insight to clients on how they can reclaim some of what they feel they've lost. And it's really not about trying to get back to where they were from a functional perspective to pre-accident or pre-injury, but really that pain is part of their experience, but that they can still empower themselves through multidisciplinary modalities, through a gradual reintegration back into social and vocational activity. And without getting into a lot of detail about what the program offered, it really did give us as students some insight into different areas to focus on, alternate forms of treatment, more modern forms of chronic pain management and so forth that could be beneficial to clients who've really been, have identified themselves as pain disabled. So there are other programs that look at chronic pain management strategies and so forth that are offered, but I really like the specific tailored courses that the McGill program offered. It was very much in line with what I'm looking to acquire in terms of knowledge and skill set to serve my clients. So really about focusing on topics in rehabilitation, topics in pain management, strategies, pharmacology. That's very specific to the context within which I work. And so I felt that the courses would best serve me and my clinical caseload. And so I really appreciated McGill's delivery in terms of addressing all of the different disciplines within the field of health and rehabilitation, all of whom are working towards a common goal of chronic pain management. I found it to be fantastic. I have a full-time clinical caseload and a young family with 2 little children under the age of 5. So really the flexibility that the program offers to do look at lectures and do my assignments at night in between clients while I'm at work really allowed me to get through it at my own pace. So I would say the online experience worked very well for somebody in my situation with full-time work, full-time life outside of the work as well. There's a client I recently had on my caseload, and the referring insurance company was looking at cutting off any funding for any further rehabilitation intervention or treatment. But the person really was engaged to get re-involved in work activity, but did not feel they knew how. They felt blocked and barriered by their pain. So I had quite an in-depth discussion with the decision maker at the insurance company about how involvement in exercise, yoga, counseling, and some form of a vocational social activity, if those could be funded, that could help the client really look at how to re-engage, how to relearn skills and abilities and move past their pain, or to work with their pain, I should say. And during this discussion, I was able to speak more in detail based on the information that I acquired through the course, and funding was eventually approved. That's rare.